In today's video, we will be discussing on effective home remedies for acne. Acne, the most common skin condition worldwide, affects millions of individuals of all ages, genders, and ethnicities. Characterized by the presence of pimples, blackheads, whiteheads, and cysts, acne can have significant physical and psychological impacts, ranging from discomfort and pain to self-consciousness and lowered self-esteem. While there are countless over-the-counter and prescription treatments available, many individuals seek alternative solutions that are gentle, affordable, and accessible. This has led to a growing interest in home remedies for acne, which harness the power of natural ingredients and DIY treatments to address the underlying causes of acne and promote clearer, healthier skin. If you find this sort of topic helpful, don't forget to hit the subscribe button below and give this video a thumbs up for more valuable content on my channel. Understanding the complexities of acne is essential for effectively managing and treating the condition. Acne develops when hair follicles become clogged with oil and dead skin cells, creating an ideal environment for the proliferation of acne-causing bacteria. Hormonal fluctuations, genetic predisposition, dietary factors, and environmental influences can all contribute to the development and exacerbation of acne. Furthermore, acne can manifest in various forms, from mild blackheads and whiteheads to severe cystic lesions, requiring tailored approaches to treatment and prevention. In this video, we will explore a variety of effective home remedies for acne, ranging from natural ingredients and DIY treatments to dietary adjustments and lifestyle changes. By understanding the underlying causes of acne and adopting holistic approaches to skincare and wellness, individuals can take proactive steps towards achieving clearer, healthier skin without resorting to harsh chemicals or invasive procedures. Whether you're dealing with occasional breakouts or chronic acne, there are numerous home remedies and self-care practices that can help restore balance to your skin and boost your confidence. Understanding acne. Acne, a multifactorial skin condition, arises from the interplay of various factors, including excess oil production, clogged pores, bacterial overgrowth, hormonal fluctuations, and inflammation. Understanding the underlying mechanisms of acne formation is crucial for developing effective home remedies and treatment strategies. Causes of acne. Acne develops when the hair follicles become blocked with a combination of dead skin cells and excess sebum, the skin's natural oil. This creates an environment conducive to the proliferation of Propionibacterium acnes, P. acnes, bacteria, leading to inflammation and the formation of acne lesions. Hormonal changes, particularly during puberty, menstruation, pregnancy, and menopause, can trigger increased sebum production and contribute to acne flare-ups. Additionally, genetic factors play a role in acne susceptibility, with a family history of acne increasing the likelihood of developing the condition. Types of acne lesions. Acne lesions can manifest in various forms, each with its own distinct characteristics and treatment considerations. Common types of acne lesions include whiteheads, closed comedones, pores clogged with trapped oil, and dead skin cells beneath the surface of the skin. Blackheads, open comedones, pores clogged with oxidized debris, appearing as dark spots on the skin surface. Papilles, small, red, inflamed bumps caused by bacterial infection and inflammation of the hair follicles. Pustules, similar to papules but containing pus at the center, resulting from bacterial infection and immune response. Nodules and cysts, deep, painful lesions caused by severe inflammation and infection of the hair follicles, often leading to scarring. By understanding the underlying causes and characteristics of acne, individuals can tailor their home remedies and skincare routines to effectively address their specific concerns and achieve clearer, healthier skin. Natural ingredients for acne treatment. Natural ingredients have long been used in skincare for their gentle yet effective properties in treating acne. Incorporating these ingredients into home remedies can help address the underlying causes of acne while promoting overall skin health. Tea tree oil. Tea tree oil is renowned for its antimicrobial and anti-inflammatory properties, making it an effective remedy for acne. Its active ingredient, Terpinenforol helps kill acne-causing bacteria and reduce inflammation, leading to clearer skin. Diluted tea tree oil can be applied topically to acne lesions as a spot treatment or mixed with a carrier oil for larger areas of the face. Honey. Honey possesses antimicrobial and wound-healing properties, making it a popular ingredient in acne treatment. Its natural enzymes help unclog pores, while its anti-inflammatory effects soothe irritated skin. Applying raw honey as a face mask or spot treatment can help reduce acne inflammation and promote healing. Aloe vera. Aloe vera contains compounds that have anti-inflammatory and wound-healing properties, making it beneficial for acne-prone skin. It helps reduce redness and inflammation associated with acne lesions while promoting skin regeneration and repair. Aloe vera gel can be applied directly to acne-prone areas of the skin or incorporated into homemade face masks and cleansers. Apple cider vinegar. Apple cider vinegar has antimicrobial and exfoliating properties that can help combat acne. Its acidic nature helps balance the skin's pH levels, reduce excess oil production, and unclog pores. Diluted apple cider vinegar can be used as a toner or spot treatment to treat acne and improve skin texture. Green tea. Green tea contains antioxidants and anti-inflammatory compounds that can help reduce acne inflammation and prevent breakouts. Its catechins help regulate sebum production and inhibit the growth of acne-causing bacteria. Applying cooled green tea as a toner or using green tea extract in homemade face masks can help soothe acne-prone skin and promote a clearer complexion. Witch hazel. Witch hazel is a natural astringent with anti-inflammatory properties that can help reduce acne inflammation and tighten pores. It helps remove excess oil and impurities from the skin's surface, making it an effective remedy for acne-prone skin. Witch hazel can be applied to the skin using a cotton pad as a toner or incorporated into homemade skincare products. Incorporating these natural ingredients into skincare routines can help individuals effectively manage acne and achieve clearer, healthier skin without the use of harsh chemicals or medications. However, it's essential to patch test new ingredients and consult a dermatologist for severe or persistent acne concerns. Home remedies and DIY treatments. In addition to individual natural ingredients, there are various home remedies and do-it-yourself DIY treatments that can help address acne and promote clearer skin. These remedies often utilize a combination of natural ingredients to target multiple aspects of acne formation and provide gentle yet effective treatment. Facial masks. Homemade facial masks can be an excellent way to treat acne while nourishing the skin with beneficial ingredients. Ingredients such as clay, honey, yogurt, and oatmeal can help absorb excess oil, unclog pores, reduce inflammation, and soothe irritated skin. Masks can be customized based on skin type and specific concerns, making them versatile and suitable for various acne types. Spot treatments. Spot treatments are targeted treatments applied directly to acne lesions to reduce inflammation, promote healing, and accelerate the resolution of individual blemishes. Ingredients such as tea tree oil, benzoyl peroxide, sulfur, and salicylic acid are commonly used in spot treatments for their antimicrobial and anti-inflammatory properties. These treatments can be applied directly to acne spots using a cotton swab or clean fingertip. Exfoliation methods. Exfoliation helps remove dead skin cells and unclog pores, preventing the formation of acne lesions and promoting cell turnover for clearer, smoother skin. Gentle exfoliation methods, such as using a soft bristled brush, a gentle scrub, or chemical exfoliants like alpha-hydroxy acids, AHAs, or beta-hydroxy acids, BHAs, can help improve acne and reduce the appearance of acne scars over time. Steam therapy. Steam therapy involves exposing the skin to steam to open up pores, loosen debris, and facilitate the removal of impurities. This can help prevent acne formation and improve the effectiveness of other acne treatments by enhancing product penetration. Steam therapy can be done at home using a bowl of hot water or a facial steamer, followed by gentle cleansing and moisturizing to maintain skin hydration. By incorporating these home remedies and DIY treatments into skincare routines, individuals can take proactive steps to manage acne and achieve clearer, healthier skin. However, it's essential to use these treatments in moderation and discontinue use if any adverse reactions occur. Additionally, consulting a dermatologist for personalized advice and treatment recommendations is recommended, especially for persistent or severe acne concerns. Lifestyle changes. In addition to skincare routines and dietary adjustments, certain lifestyle changes can play a significant role in preventing and managing acne. By adopting healthy habits and minimizing potential acne triggers, individuals can promote clearer skin and reduce the frequency and severity of breakouts. Stress management techniques. Chronic stress can trigger hormonal fluctuations and exacerbate acne symptoms. Implementing stress management techniques such as meditation, yoga, deep breathing exercises, and mindfulness practices can help reduce stress levels and promote overall well-being. Engaging in regular physical activity, spending time outdoors, and pursuing hobbies and interests can also help alleviate stress and improve skin health. Skincare routine tips. Establishing a consistent skincare routine tailored to one's skin type and concerns is essential for maintaining healthy skin and preventing acne breakouts. Use gentle, non-comedogenic cleansers and moisturizers suitable for acne-prone skin, and avoid harsh products that can strip the skin's natural oils and cause irritation. Incorporate acne-fighting ingredients like salicylic acid, benzoyl peroxide, and niacinamide into your skincare regimen to target acne-causing bacteria and promote cell turnover. Importance of regular exercise. Regular physical activity not only helps reduce stress levels, but also improves blood circulation, boosts immune function, and promotes detoxification, all of which contribute to clearer skin. Aim for at least 30 minutes of moderate intensity exercise most days of the week, incorporating a mix of cardiovascular, strength training, and flexibility exercises for overall health and well-being. By incorporating these lifestyle changes into their daily routines, individuals can take proactive steps towards preventing and managing acne. However, it's important to remember that results may vary, and consistency is key in achieving long-term improvements in skin health. Additionally, consulting with a dermatologist can provide personalized recommendations and guidance for addressing specific acne concerns. Precautions and consultation. While home remedies can be effective for many individuals, it's essential to exercise caution and seek professional advice when needed, especially for persistent or severe acne cases. Here are some precautions to keep in mind. Patch testing for allergic reactions. Before using any new skincare product or home remedy, perform a patch test on a small area of skin to check for allergic reactions or sensitivity. Apply a small amount of the product to the inner forearm or behind the ear, and wait 24-48 hours to see if any adverse reactions occur. Consulting a dermatologist for severe acne. If acne persists, despite home remedies, or if it's accompanied by severe inflammation, pain, or scarring, it's crucial to consult a dermatologist for professional evaluation and treatment. Dermatologists can prescribe medications, perform procedures, and provide personalized recommendations based on individual skin type and concerns. Couch on with home remedies for sensitive skin types. Individuals with sensitive skin should exercise caution when using potent ingredients or DIY treatments. Some natural remedies, such as lemon juice or harsh exfoliants, can be too harsh for sensitive skin and may cause irritation or allergic reactions. It's essential to start with gentle ingredients and patch test new products before applying them to larger areas of the skin. Remember, consistency is key when it comes to achieving clear and healthy skin. Give these remedies a try and see which ones work best for you. If you have any questions, or if you've tried any other effective home remedies for acne, let me know in the comments below. If you are interested in learning home remedies for dry skin, click the link above and watch the video.